back to the channel. If you are new here, my name is Owi, a nurse who is passionate about mental health and addiction recovery, bringing you honest conversation about mental health and addiction recovery. Today we are diving into a question so many people struggle with. Is therapy enough, or do you need medication too? We are breaking down the science, the myths, and helping you understand what a balanced, effective approach to recovery really looks like. Whether it's depression, anxiety, addiction, PTSD, or another mental health challenge, understanding your options is key to healing. Let's get into it. Let's dive into the basics. What are counseling and medication? Counseling or therapy include cognitive behavioral therapy or CBT, dialectical behavioral therapy, also called DBT, family therapy, and etc. They help process emotions, develop coping skills, they change the thought patterns. While medication, on the other hand, include antidepressants, mood stabilizers, and antipsychotic, anti-anxiety meds. They alter brain chemistry to stabilize the mood and reduce symptoms. Both medication and counseling, which is also therapy, have their place. They are tools and not cure. Recovery is often multifaceted. Someone may ask, is therapy enough for everyone? Evidence-based points out that some mild to moderate conditions, example, mild anxiety, situational depression, respond well to therapy alone. Also, talk about the 2021 APA guidelines. For many, therapy alone can lead to symptoms reduction. But in moderate to severe conditions, therapy may not be enough alone. Example, severe depression with suicidal thoughts, bipolar disorder, schizophrenia, substance use disorder with high relapse risks. Therapy alone may not be enough. Another person may ask, is medication enough? Medication isn't a magic pill, but for some, it creates the stability needed to actually engage in therapy or daily life. Sometimes we give medications just because we want that person to relax when he wants to engage in therapy or even some activity of daily living. Evidence-based example, depression. Meta-analysis in 2018 states that antidepressants are more effective than placebo. Placebo is a medication for psychotic diseases, especially in severe cases. Anxiety disorder, SSRIs, and CBT shown to be more effective together than either alone. Addiction recovery. We found out that medication-assisted treatment for opioid use disorder reduces overdose risks by over 50%. We can now see that medication creates a window of stability for therapy to be most effective. The foundation of lasting recovery. Medication may reduce symptoms, but therapy builds long-term skills. Counseling teaches emotional regulation. It teaches coping strategy. Counseling teaches identifying triggers. Counseling or therapy teaches resilience and self-awareness. Longitudinal studies shows therapy leads to long-term lasting symptoms improvement compared to just medication alone. Counseling is especially vital for trauma recovery. It's also vital for addiction. Counseling is vital for relationship, family issues. What is the balanced, individualized approach? The real answer to this question isn't medication or therapy. It is finding the combination that works for you. Recovery isn't one size fits all. Integrated approach often include medication if needed, therapy tailored to your needs, support groups, example, Alcoholic Anonymous, which is AA, or Narcotic Anonymous, which is also NA, peer support, healthy lifestyle changes, collaboration with healthcare provider is crucial. Stigma prevents people from getting help. Knowledge breaks stigma. I'll give you an example. It's a real life example. I'm not going to mention name. I know someone, I'm going to call her name Nancy. Nancy battled with depression for years. She cried, she screamed. For many years, she battled depression. She tried therapy, but couldn't even get out of bed some days. Once she started medication, it gave her enough stability to actively participate in therapy. Today, Nancy is thriving, not because of one thing, but because of the combination that worked for her. Another example is about a guy I met who is about 35-year-old now. He said he started doing substance abuse at the age of 17. He told me he left his father's house and went to the street to be abusing substance. He said he started with fentanyl. From fentanyl, he migrated to heroin. And from heroin, he started doing cracks and cocaine. Today, he is free and he is an advocate for addiction recovery. He goes around to different cities advocating, telling young people how substance can damage their life. He told me he recovered when his parents went to the street and found him and brought him home. He said at first, they started with just medication. Medication, he will get stronger, but before you know, he will relapse again and go back to the streets. But immediately they discovered therapy, it really helped. While he was taking the medication, it helped him also with the therapy. And he became stronger. And today, for more than 10 years, he is and today he's advocating. So, is therapy enough? Sometimes it is. Is medication bad? Absolutely not. The truth is, your recovery is personal. And the most powerful things you can do is work with your healthcare team to find the right mix for you. If this clarifies things for you, if this helps you in any way, give it a thumbs up and share it. Someone else might need this. Don't forget to subscribe. We talk all things mental health and recovery and reducing the stigma. Thank you so much for watching. Please comment down below and tell me how this has helped you. See you in my next one. Thank you.